Today we're going to talk about a topic that is super important but just does not get talked about enough, and that is ADHD and the connection to eating disorders. ADHD and eating disorders is a very complex relationship that affects, unfortunately, so many of us ADHDers, but it's usually flying under the radar and not talked about enough. So let's explore how these two are connected and bring out the most important parts and hopefully find ways to find healing and balance for yourself and different treatment options. So recent research studies have shown that there is a strong correlation between ADHD and eating disorders, and that about 30% of people who have been diagnosed with binge eating disorders have also shown symptoms of ADHD, which is quite high. So what are even eating disorders and what falls under the category of eating disorders? So eating disorders represent a category of mental health disorders which have a detrimental effect on not only mental health but also physical health. And for those individuals who do have an eating disorder, often display harmful behaviors and attitudes that are related to either food consumption, eating habits, or body image perception, or all of those. Then there is binge eating disorder, which is somewhat similar to bulimia, but it is lacking the compensatory actions like the purging afterwards. And lastly, there is anorexia nervosa, which includes severe food restrictions and fixations on certain safe foods. Now, let's explore why so many ADHDers do struggle with eating disorders. Now, why is it that so many of us ADHDers do struggle with eating disorders like bulimia or binge eating disorders? So firstly, a lot of characteristics that come with eating disorders also come with ADHD. So the core traits of ADHD like hyperactivity, impulsivity, and inattention are all parallel behaviors that are often observed in binge eating episodes because they're often very impulsive actions. And also for ADHDers, they might engage in overeating to seek stimulation to increase dopamine. And then secondly, also ADHDers often engage in overeating in order to seek stimulation from food to increase dopamine production. So for example, someone with ADHD might struggle with an eating disorder because they're very impulsive around foods, which can then lead to these binge eating episodes, or they might compensate for stress that can result in binge eating episodes. Another reason is our challenges when it comes to executive functioning skills, like with planning or the organizational challenges, which can all manifest in challenges in our eating habits. So we might skip meals, we might delay meals, we might forget meals, which are then followed with these episodes of binge eating, overeating. And then with these challenges that come with executive functioning skills, and all these challenges can exacerbate feelings of guilt and shame, which can perpetuate the cycle of disordered eating behaviors. Now, when it comes to diagnosing ADHD and eating disorders, this is not always easy because they have so many overlapping symptoms, which can often make the diagnosis as well as the treatment challenging. For the prevalence in genders, we often see more females who face a risk of developing eating disorders, but also males do have eating disorders and are hugely affected by it. And research has also shown that males are less likely to seek a diagnosis and treatment for their eating disorders, which makes them also very vulnerable. Now, if you feel like you're struggling with any of these challenges that we just talked about, or you know someone who's struggling with any of the things that we just talked about, please know that you're not alone and that there is help and support out there, and there are different treatment options available. So for the different treatment options, for ADHD and eating disorders, that often involves medication. So it could be stimulant medication that is normally used for ADHD, which can alleviate a lot of our ADHD symptoms and a lot of our executive functioning challenges, which can then already improve eating disorders or alleviate all the symptoms. Then there are also other medications out there that can target ADHD and eating disorders. So one of these medications that could treat ADHD and eating disorders is called lisdexamfetamine and dimethyl, which could potentially address your ADHD as well as your eating disorder challenges, then therapy can also be very helpful, especially cognitive behavioral therapy, in reducing not only ADHD symptoms, but also alleviating stress, anxiety, depression, which can also fuel eating disorders. You can also seek help from a registered dietitian, which can also be very, very helpful and supportive, and ideally finding someone who has knowledge and background in ADHD. I've also listed some more helpful links and resources down below in this description for more help and support. And if there's one thing that I want you to take away from this video, is that you're not alone in your struggles and that there's help and support out there. Thank you for watching this video here on ADHD empowerment. If you enjoyed the content, please leave a like, and for more weekly videos exploring ADHD topics, join me by subscribing to the channel. Together we can navigate all the challenges that come with our ADHD symptoms.